16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahala. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
Hello everyone, good evening. Welcome to a brand new episode of BMC Global Lab, Al Hilal Health World, Nothing But Lifestyle. I am Jasila Mujib, your host for today. As you are aware, October marks Breast Care Awareness Month. It focuses on spreading awareness and supporting people living with cancer. Today we are going to discuss the topic breast cancer awareness. We have with us Dr. Radhika from Al Hilal Hospital, Riffa. She is a specialist gynecologist and laparoscopic surgeon with an experience of 8 years in her field. To discuss this relevant topic, let's welcome doctor to the show. So doctor, who all are at risk of breast cancer? Can you please explain for us?
Yes. Women who are more than 50 years of age and women who have a strong family history of breast cancer in their family, and those who have an exposure to radiation or hormones at an early age, and women who have not given birth to children, or we call them nulli gravida, or who tend to plan pregnancy at a late age, and women who have early menarche, who get their periods as early as 10 to 12 years, and who have a late menopause. All these come under high risk categories. And women who have other comorbidities like obesity, hypertension, diabetes, they also they come into this risk factor groups.
Okay, doctor. Doctor, please explain the symptoms of breast cancer for our viewers.
Okay. Symptoms of breast cancer usually will be a lump. So lump will be identified by the woman when she examines her breast.
Okay.
So that lump could be either painful or painless, and there will be certain changes in the skin over the breast. There will be redness, There will be flakiness, itching over the skin of the breast, and the color will also be altered. And the nipple area will be retracted, and the skin appearance will be uneven and irregular, like there will be uneven thickening of the skin, like a dimpling, puckering, and more often you can feel like a orange peel. And there will be an abnormal discharge also coming from the breast, like it could be blood or pus. So, and you can see other lumps in the armpits and also over the collarbone.
Okay. So, if we find some of the symptoms, what are the tests to be done to diagnose it as breast cancer?
So whatever the lumps that are identified by the women, if she brings to the notice of the doctor, the same lumps will be examined. We call it triple assessment.
Okay.
So first is a clinical breast examination. So whatever the lumps the women have identified, that will be examined again by the clinician. So the lumps will be subjected to imaging modalities like ultrasound, mammography, MRI, and we can further assess with the help of biopsy and FNAC also.
Okay.
The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahla. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
So, are all the lumps found in the breast, are they turn cancerous? Will they turn cancerous?
No, not all the lumps that we identify are cancerous. Only 60 to 80%, most of them are benign only. Only 10 to 20% they turn out to be malignant.
Okay. Now you mentioned about the lumps.
Yes.
What is fibroadenoma breast?
Okay.
Please explain.
Fibroadenoma is a benign lesion. It is not a cancer lump. It is usually freely mobile. We commonly call it as a breast mouse. So it is freely mobile and it is generally usually painless, and the borders can be differentiated easily. There will be regular borders. They generally do not cause any symptoms. So women, they have any symptoms like pain or the size, there is a sudden increase in the size of the fibroadenoma, or who have a family history of cancer, they can remove it earlier.
Okay. What are the tests to be done to identify benign and malignant lumps?
Mammogram is a diagnostic tool available with us. So it can screen as well as diagnose. The staging and the grading of the cancer can also be done with the help of a mammogram. And other modalities are also there. Ultrasound, MRI, FNAC and biopsies can be done.
Okay. Doctor, is breast cancer found during pregnancy?
Yes.
Is it?
Yeah, this is one of the overlooked thing in pregnancy, because in pregnancy there is usually some physiological changes going on, like there will be increase in the size of the breast, there will be pigmentation developed around the skin and the nipple, and there will be occasional milk secretion coming from the breast. So these pathological symptoms often go masked with these physiological symptoms, and by the time the diagnosis is done, the women may present an advanced stage of carcinoma.
Okay.
So, women who go for the regular antenatal checkups and the postnatal checkups, they should also get their breast examined regularly.
Okay. If the pregnant women are diagnosed with breast cancer, will it affect the fetus?
Breast cancer per se does not go into the growing fetus,
Okay.
because there is a strong barrier, what we call is uteroplacental barrier.
Okay.
So that doesn't allow the cancer cells to enter into the fetal circulation. So cancer cell doesn't cause any anomalies or any teratogenicity to the fetus. But if the woman is going undergoing any intervention like surgery or any chemotherapy, the other anticipated obstetric complications like abortion, preterm labor, those can be expected.
Okay. When the women are diagnosed with breast cancer, can they breastfeed the children?
It is usually not recommended,
Okay.
because if the woman is diagnosed with breast cancer, she will be undergoing a multimodality treatment like surgery, chemotherapy, radiation. So these drugs, they get secreted into the breast milk, which are harmful to the fetus. So it is generally not advised. So women can switch on to an alternative method for feeding.
So doctor, I have heard that in males also we find breast cancer. How common is it?
Males, they carry a risk of breast cancer, but is usually rare.
Rare.
Yes. Like breast cancer in pregnancy, this is also often overlooked, as generally males don't present with those complaints. So if a lump is identified in the breast, men also should equally get screened with the help of mammogram, because in men the breast cancer will be a more aggressive type. So by the time the diagnosis is done, the staging will go on to an advanced stage, and mortality is also very high in breast cancers in male.
But it's not very common.
Not very common, it's rare.
Okay. It's always said that early detection saves lives in cancer.
Yes.
Please explain it for us.
Early detection do have a positive impact, because it improves the survival rate of the patient. The patient quality of life can be improved. She can quickly resume her daily activities also. And the treatment options will be more, and the surgical intervention or anything will be less extensive. So it will be equally cost effective too.
Okay.
So it is a kind of secondary prevention.
Yeah. So doctor, any advice from your side for our viewers on your topic, breast cancer awareness?
Okay. So women should regularly examine their breast. We call it breast self-examination. This can be done every month after periods. If they notice any abnormal lump or any other skin changes, they can bring to the notice of the doctor. And screening mammograms should be advised. Every woman should undergo screening mammogram as early as 40 years. And those who have a family history of breast cancer, they should screen at an early age also. And inculcate healthy lifestyle, do exercises regularly. If the obesity like risk factors are there, they should keep a check on the BMI, and eat healthy and stay healthy.
Thank you, doctor. Thank you for being with us, especially in the month of October.
Thank you.
The month of breast care awareness. Thank you once again.
Thank you.
So viewers, I hope this was quite an informative episode. As doctor told us, early detection saves lives. So take care of your health, stay happy, stay healthy. This is Jessila Mujib signing off. Good night.
16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahala. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.